Zuli Palacio spends as much time as she can these days at her pottery wheel.
Pottery has been my mind and physical therapy for 15 years. It's extremely relaxing, it's very creative, and again, it's something that takes your mind from something difficult.
Palacio was diagnosed with breast cancer in March, has been through chemotherapy, and now has decided to have both breasts removed, even though her cancer is only in her left breast.
I personally have decided to have a double mastectomy. The reasons are many.
Among them, the chance that the cancer will come back.
The idea of spending the rest of my life with a Russian roulette, and thinking at what time this thing is going to go bad, it's not for me. It's not for me.
It's also called the Angelina Jolie effect, since the actress had a double mastectomy after genetic testing showed she had a high risk for both breast and ovarian cancers. The idea of preventative surgery is a controversial one. Dr. Marc Boisvert at MedStar Washington Hospital doesn't recommend it.
I think education of everyone is important here, because I think you can get peace of mind knowing that you're being monitored very carefully and knowing what the numbers are, what the chance of recurrence, for instance, are.
Overall, she's tolerating treatment fairly well.
Palacio's doctors say a double mastectomy isn't necessary.
I know.
But nurses and other breast cancer patients told her to go ahead with it.
Okay. I have 3 friends that had one mastectomy, and 2 or 3 years later, cancer came on the other side, and they had to have the second mastectomy. They said that is a very hard experience. They all told me, Zuli, go for the double mastectomy now and don't wait.
Despite differences of opinion, most doctors agree that a patient must be comfortable with her care, whether it involves careful monitoring, aggressive treatment, or surgery. Carol Pearson, VOA News.
Very peaceful.